So I'm Murray Stewart, I'm 21 years of age, and when I was 18 I was diagnosed with cancer called astrocytoma, which is a sort of tumour found in the brain.
I was diagnosed when I was 21. I'd recently got a call to say to come up to the Beatsons. I remember walking up to the Beatsons and it was the longest walk of my life. I was diagnosed with Ewing sarcoma, which is a rare bone cancer.
So alien, been told you're, diagnosed with cancer, you're facing treatment, chemotherapy and radiotherapy. It's all pretty scary.
And it was just crazy. I just turned to my mum and she was like, yeah, we can do this. It's gonna be fine. And I believed her.
A diagnosis goes far, far further than the individual. It of course affects people around you, friends, family. Everything sort of really, really changed, and at that time all you want is normality.
At the time I was living by myself in Glasgow. I'd just come back from travelling. I was really independent and excited about the future. I was going to go to uni, and then suddenly everything changed. I had to move in with my mum. Suddenly all these plans that I'd made were gone.
Going to scans together, getting results together, all of that was very, very difficult, and I was very lucky that I had my parents there to help me out in that sense.
My mum took leave from her work. My sister at the time was in another country and she dropped everything and flew back to look after me, and it was, yeah, they were great supports, but I think some of my family really struggled to deal with the reality of the situation.
I was always keen, I think my parents were as well, to come along, receive results, as well as having your sort of clinical team around you as well. I felt worked well with in terms of communication.
You know, if you're going into an appointment and you want to tell them maybe uncomfortable side effects you've been having, but your parents are there or your mum's there and you're embarrassed and you're just kind of like, oh well, I'm gonna have to ask her to leave the room or I'll talk about this.
I had a nurse when I was during my time on chemotherapy, and as an inpatient I woke up in the morning and my specialist nurse came in and asked me if I'd seen a doctor that morning, and I said no. 2 minutes later the specialist nurse returned dragging an oncologist in with her to check up on me. I remember it so well. So there is a stigma, there is a big taboo around cancer. When someone hears cancer, they jump to conclusions, I feel.
So I was sitting with my friend and I was like, I've got something to tell you. And she was like, oh, you're pregnant. I was like, no, got cancer. And she's just like, what?
So initially telling people, whether they were my brothers, were my good pals or distant family, that was a tricky time. Especially those people wanting to know more, wanting to ask more questions.
Try not to push yourself, because I'd always be like, oh, I want to do this, I want to do that, but you can't, because you're running yourself into the ground.
I wasn't doing a huge amount. I was on treatment. I was feeling pretty grotty at the time. Felt down at the time, and really I wasn't doing that much. Whereas now, being past treatment, being past surgery and my diagnosis, managing that is done by keeping myself busy, keeping myself studying, keeping myself fit. Those are things I do which help me manage my situation.
Thinking about the future, like planning uni and planning like holidays after treatment, and really genuinely I was counting down the days. So every treatment I was like, okay, only like 13 to go, only 12 to go.
Nearly 2 years ago today I had my last dose of radiotherapy, and I now receive scans every 6 months, just to keep an eye on my tumour, just to make sure everything's all good. So now I'm a student at the University of Glasgow, about to start my 3rd year, and I'm feeling fit and healthy.
So it's been a year and a half, and I feel like it's another person. It was another time. I'm just like living my life.